Hello, everybody. This is Jess Biggs. I'm a physiologist and I'm the co-founder of Neuropathy Center of New Mexico. I welcome you to today's presentation. What we're really going to talk about is how to get lasting relief if you're having pain, numbness, burning, cramping, those types of symptoms. How do you get relief of those things without drugs or without surgery? And so that's our topic for today. You probably decided to attend this event because of something you got in the mail that you identified with, that you're having some of these types of symptoms. And so now you're here to learn, and I appreciate you being here. I congratulate you. Um, if you'd like to feel a 60 to 100% improvement in those types of symptoms, if you are having those symptoms, well, you're in the right place because those are the types of results that we get at the Neuropathy Center of New Mexico. And here in a little bit, I'll be talking about how we do that. Well, before we get into the details of how and what, I want to congratulate you on making the decision to be here. Now, let me just address one thing really quickly here. One is that this is a little atypical for us. Usually, we are doing these types of events at a restaurant or a hotel and providing this kind of education and this seminar in those types of environments. But as you know, in this day and age, we've got a lot going on in terms of the coronavirus. And so therefore, we're providing the solution to you because this is really important information for people that are suffering from these types of things. And we didn't want to delay you getting this information. So one of the things that I'm going to ask you to do is stick with me through this. Yeah, I know it's a long video to watch, whereas if you came to one of our events, it would be a little more dynamic, a little more interactive. But I'm going to ask you to stick with me through this video because you're going to get some great information, and at the conclusion of this, I believe you will say, this was well worth my time. In spite of all that, again, I do want to congratulate you on being here and watching this video. For everybody that's watching this right now, there are thousands of people that are just suffering and that don't know about this and aren't going to learn the things that you are going to learn today. So, thank you for being here. Secondly, I just want to talk about the price for attending this workshop because it's not free. Maybe you think it's free, but it's not. In reality, there is a price to be paid. And the price that I'm going to ask you to pay for attending today's workshop is to keep an open mind, be willing to learn something, and be willing to take some action. Because only by taking action upon the things that we learn do we really make a difference. So I hope that price tag is not too steep for anybody and that you're willing to pay it. Now, before we go any further, I just want to talk a little bit more about why I personally am here. We'll talk more about the Neuropathy Center of New Mexico and the details around that, but I want you to know why I'm here, me as an individual. And in order to do that, we need to go back in time just a little bit, and I'm going to tell you a little bit of a story. And that story happened in 1983, or started in 1983, and I happened to be at a track meet. And at that track meet, through the course of it, I looked up across the field and I saw one of my uncles walking towards me across the football field. And I wondered to myself, I kind of scratched my head. I said, I wonder why that uncle's at my track meet. He's never come to any of my track meets before. I don't even think he likes me all that much. And so I wonder why he's here. Well, I soon found out because he walked up to me and he said, Jess, I need you to come with me because your dad's been burned in a fire. And my dad worked in the oil and the gas fields. We lived in the area of Farmington, New Mexico, which is very heavily oriented around oil and gas. And he'd been very severely burned from the waist up, over 60% of his body, second and third degree burns. They airlifted him from Farmington over to the burn and trauma unit at UNM, and there he stayed for the next 5 weeks in intensive care. One of the first things that they had to do is they had to take skin grafts from his thighs, which were not burned, and use that skin to graft into his face and his hands in terms of grafts and creating some skin there. Secondly, if you're familiar with burn treatment, what they would have to do every single day, twice a day, is they'd have to scrub the burns and the graft sites to keep them from getting infected every day, twice a day. It's very, very painful, as I'm sure you can imagine, and maybe some people have even experienced. Well, after 5 weeks, they sent him home and they instructed us that we needed to continue those treatments at home. The only thing, there was two problems with that. One is that he wasn't strong enough to get himself up out of the bathtub after those treatments, as well as the fact that most of the time he would just pass out because of the pain. And secondly, my mom is a little bitty thing of 100 pounds and 5 foot something, and she wasn't strong enough to lift him out of the bathtub. So it became my job at the very young age of 15 years old to lift my dad out of the bathtub every day. That was a very, very humbling experience for me. This was a man who had cared for me, and now suddenly I was in a role of being a very intimate caretaker of him. And so very humbling. Well, fast forward 3 years. 3 years later, I'm out of high school. I'm working a job. I get off my job one evening about 11 o'clock at night. I go home and I go to bed. And about 2 o'clock in the morning, my mom is shaking me saying, "You need to get up. Your dad's been burned in another fire." He had only been back to work about 7 months when once again he was burned in another fire, and even worse this time. And so we went through the whole process again, and once again I found myself in the position, in the role of being a very intimate caretaker of my father. Well, you may be asking yourself at this point, well, why are you telling this story? Well, it's really simple. That's really what brings me here today in order to present this information to you, is because those experiences put me on a path in my career of wanting to help people relieve their suffering and wanting to help people improve the quality of life that they lead. And so I've spent my career in doing exactly that. And most of that career has been in the form of a health coach and coaching people around their health in terms of how they can make improvements to have a high quality of life. And most recently in founding the Neuropathy Center of New Mexico and identifying very valid and worthwhile solutions in helping people relieve some of the terrible things that can be caused by neuropathy or nerve damage. That's why I'm here. I'm very, very passionate about helping people. I have a huge passion for helping them improve their quality of life and in guiding them and offering solutions to them. So now that you know why I'm here, let me just say that Neuropathy Center of New Mexico is in Rio Rancho. We're on Southern Boulevard, and we have great solutions that I want to talk about here as we get through some of this. But I want to stage and frame some of that before we get to those details with a few other things. Now, I want to ask you, if you're sitting at home watching this, how can you get relief? How many of you are experiencing numbness in your hands or your feet? I know I can't see you, but maybe raise your hand just to acknowledge to yourself. Is that something you're experiencing? How about sensations of burning? Do your feet or your hands feel like they're on fire, or they're having burning sensations? What about hand pain or feet pain, pain that has become somewhat debilitating or preventing you from doing things that you would really want to be doing? Maybe you're having back pain or joint pain. Again, any pain that's preventing you or keeping you from doing things that you really love doing. Maybe you used to be able to do them and you're no longer able to, or they're just more challenging. Well, this talk is for you if you're experiencing those types of things. Here's what I promise you're going to know at the conclusion of this. You're going to know, first of all, the challenging truth of what's called the standard of care or the standard of treatment. What that means is if you go to your primary care physician about things like numbness, tingling, cramping, pain, what is the box that they're going to operate in terms of what they're going to offer you for solutions? And they won't really operate outside of that box, because the standard of care says, here's what we do for these kind of cases, for these kind of patients. So what does that look like? We're going to talk about that. What could be causing your pain? What could be the root of it? Some documented dangers of neuropathy or nerve damage, because it can be very dangerous and very serious. Proven methods for creating lasting relief. And finally, some steps that you can take to getting better, feeling good again. So that's what you'll know at the conclusion of this. Now, how many of you are so excited? You get up in the morning and you're just like, woohoo, I get to take my medications this morning. Anybody so excited to do that? Yeah, I don't think so. Most of us are not. But here's the reality, something that you should know, is that on average, if you're over 65 years old, you will be introduced to 18 new prescriptions each and every year. That's an average. Some people will be less, some people will be more, but on average, 18. That is a lot. That is quite a bit. Time did a cover story a few years back on a couple of different things. One of the things they talked about in this cover story was that they surveyed thousands of Americans and they found that most Americans felt like they were heavily over medicated. Number two, because of that, they also talked about opioids. You know what opioids are. You've heard of them. They are very, very, very good painkillers. They do a great job at killing pain. Unfortunately, you also know that they are very addictive, highly addictive, so much to the point that today in the United States, there are more people addicted to pharmaceutical medications than there are illegal drugs. A big deal. With that, we see an increase in all kinds of chronic disease. You already know this. You've seen this stuff before. For example, diabetes. Did you know that currently 40% of the population in the United States is either diabetic or pre-diabetic? 10% is diabetic. That means 30% is pre-diabetic, which pre-diabetes means if those people do not do something differently, in the next 7 to 10 years, they will become full-blown diabetic. You can imagine what our population would be like if 40% of the population were diabetic. Very, very serious problem. Combine that with things like heart disease. You know this. Heart disease has been increasing for years, for quite a long time. It was the #1 killer in the United States. Continues to increase. Well, guess what? Neuropathy is not that different. We're seeing an increase in the number of people that are experiencing neuropathy or neuropathic symptoms. And it's very much related to some of these other chronic diseases. So as those go up, then neuropathy goes up. It's going up very quickly. Well, Time did another cover story a few years after the first one. And this one they talked about how much we spend on medical costs in the United States. Anybody want to guess how much money we spend on medical costs? Well, again, obviously I can't see what your guess might be, but in your head, guess what that is. And if you guessed in the trillions, you are correct. We are currently spending $3.2 trillion plus on medical care in the United States. A lot of money. Combine that with the fact that in the United States, we actually consume 75% of the medications produced in the entire world. But if you think about the population of the US in terms of the world population, there's about 7 to 8 billion people in the world. The reality is that the United States only makes up 5% of that population, yet we're consuming 75% of the medications. In that, you also think about we have the most doctors, we have the most hospitals, we're spending the most money. What should we be able to assume about our health? We're spending $3.2 trillion. We are consuming 75% of the meds. We got the most doctors, hospitals, and we're spending the most money. We should be able to assume that we're very, very healthy. But are we? Well, when you look at the number of countries in the world, there are essentially 38 of those countries that are considered developed. There are more countries than that, but 38 that are developed. Where do you think we rank in terms of our health compared to the rest of the world? Not very good. We're not even in the top 10. And in fact, we are exactly number 35 out of 38. This is according to the World Health Organization and the statistics that they gather in terms of all kinds of parameters around our health. We are not very healthy. In fact, Costa Rica is number 34. They're higher than us. So what's going on? What's causing some of this? Well, there's lots of things that are causing it and contributing to it, but there is one thing that is significantly contributing to this, and that is that every single household in America has 2 washing machines. Yeah, that's right. That's what I said, 2 washing machines. One of those washing machines you wash your clothes in, and the other you wash your brain in. What do we call that brain washing machine? That's right, we call it the TV. We used to call it the boob tube. What do I mean by this? Well, what I mean is that we are just constantly bombarded with so much advertising and so many different things that eventually we just come to accept that's the way it is. Now, none of us like to think that we're brainwashed. The more appropriate term for it is called social conditioning. And this is especially true with pharmaceutical medications. Nobody here has ever seen a pharmaceutical ad, correct? Yeah, of course. I'm not being serious by saying that. We've all seen the ads and we see them constantly. And when it comes to these types of things, when it comes to our health, we're just bombarded so much with these pharmaceutical ads that we eventually accept that that's just the way it is. That's how we handle our health issues. And you've seen the ads, you know what they look like. They show like somebody maybe walking on the beach, it's all nice and sunny. They're essentially saying, when you take this medication, this is what you can have. And that's about 15 seconds of the commercial. And then the rest, the next 45 seconds of the commercial is what? Yeah, that's right. All the side effects, all the side effects about what could happen if you take this. You could have bleeding, you could have, shortness of breath, you could have risk of suicide, you could even die, right? All that list. And then what do they say at the conclusion of every single ad? Go ask your doctor, right? Go ask your doctor. And so that's how we've been conditioned to handle our health issues. So with that, we're being really persuaded very, very heavily. And in fact, how much would you guess the pharmaceutical industry is spending in TV advertising per year? Well, if you said in the billions, you are correct. $4.5 billion per year that's being spent on pharmaceutical advertising on TV. And so that's a lot of money. Is it working? Well, they're not spending $4.5 billion for nothing, but you have to ask the deeper question of, is it really working? So what are the most common culprits? If you go to your primary care physician and you tell them that you have numbness, tingling, cramping, foot and hand pain, those types of things, what are the most common prescriptions that they might provide to you or recommend to you? Well, the first is Neurontin. It's more commonly known as gabapentin. Um, Gabapentin, uh, do you know what it was originally developed for? Well, it was originally developed as an anti-seizure medication. Somewhere along the way, somebody gave it to people with neuropathy and it actually helped some of their symptoms. Then Pfizer, who makes Neurontin, decided to take that and use gabapentin and say, let's rename it to sound kind of like neuropathy, hence Neurontin, and package it that way. But the way that it works is that it simply slows down your brain so you don't feel the symptoms in your feet and your hands. It just simply blunts those things that you're feeling is the way that works. Now, what most of our uh, patients that come into our clinic, the way that they describe how they feel on gabapentin is that they just feel like they're in a brain fog. Not all of them, but that's the most common way that it's described to us by our patients. Now, most importantly, is that ultimately this medication does not stop the progression. And one of the things that you should know about neuropathy is that according to the research and statistically, neuropathy always, always, always gets worse. It always progresses. How long it takes to progress may vary vastly from person to person. Some people it may take years and years to progress. Other people it may progress very, very quickly. But ultimately, it does progress, and just medicating with gabapentin or Neurontin does not stop the progression. What about Lyrica? Have you seen ads for this on TV? Absolutely, you have. You know why you've seen it? Because Pfizer also makes Lyrica, and Lyrica is their number 2 drug or medication in terms of how much money they spend each year in advertising. Number 2, they spend only more money on one other medication than Lyrica. And so that's why you see so many ads for Lyrica. Well, guess what Lyrica is? It's an anti-seizure medication. It simply slows down your brain so you don't feel your feet. And ultimately, it does not stop the progression. Okay. Now, how many of you would, if your car is just completely falling apart, just take some duct tape and just tape it back together? Well, some of us would, but often what we find is that people will treat their cars better than themselves. And does that really make sense? When you're talking about your independence and your mobility and being able to use your feet and your hands, Does it make sense to treat our car better than ourselves? Well, what about this? What if you saw this come up on the dashboard of your car? What would you do? What is this telling you? Check engine light tells you that something's not right and you need to do something. Now, one of the things we could do is we could take a piece of duct tape and we could just cover up that light so we can't see it, right? I mean, that is an option. But does that really resolve the problem? Of course not. The only thing, the most prudent thing to do is go see a professional. Find out what's really going on. Call them up. Say, got a check engine light on. They're going to say, come in and let us take a look at it. We can identify what's wrong and then give you options on what to do from there. Now, if you're having some of the things that we've already talked about, the numbness, the tingling, the burning sensations, those symptoms are alarms that are going off to tell you something is not right, just like that check engine light. Something is not right, and you need to do something. So I want you to imagine if you're sitting in your living room one evening and the fire alarm goes off, and you get up out of your chair, you walk in the other room, and you see that your curtains are completely on fire. And so you walk over to the alarm and you snip the wire to it so it stops going off, and then you go back and sit in your chair and you finish watching your TV show. Does that make any sense? Absolutely not, because the alarm is going off, and if all we do is silence the alarm, guess what? The curtains are still on fire, and the curtains are going to burn up, and eventually the house is going to burn down. So just silencing the alarm with medication is not the answer. So what is peripheral neuropathy? Sometimes we get to this point in the presentation and some people are even still wondering what neuropathy is. So let's talk about that for a second. Neuropathy is damage to or disease affecting the nerves. You can have neuropathy in any part of your body. Any nerve in your body can have neuropathy. But if you recall, there are different nervous systems. There's the autonomic nervous system that just takes care of things automatically, like heartbeat, breathing, digestion, those types of things. And then we have the other nervous system. We have the central nervous system made up of the brain and the brain stem and the spinal cord. And then we have all these nerves coming out of the central nervous system, which are called peripheral nerves. And peripheral nerves, generally, we're talking about things associated to the feet, the legs, the arms, the hands, and the back. So anytime we have damage or disease that it's affecting the nerves of these areas, it is called peripheral neuropathy, neuropathy that exists in the periphery. Okay? So that's what neuropathy is. It's quickly becoming a very common chronic disease, not just in the US, but even globally, worldwide. Currently in the US, about 8% of the population has neuropathy. And you may say to yourself, well, 8%, that's not that much. But that's 24 million people. And in our own community right here of Albuquerque, that's 60,000 people that are suffering from neuropathy and neuropathic type symptoms. So it's a really big deal, and a lot of people are suffering. Most of the time it occurs in older adults, but it really can occur at any age. We actually see people in our clinic in their 30s. Diabetes is the most significant contributor or cause of neuropathy, but it's also only about 30% of the cause. That's why often you hear it called diabetic neuropathy, but it's, again, only 30%. That means 70% is caused by other things. We'll talk about that more here in a second. Now, what are the 7 most common warning signs of peripheral neuropathy? You already know what these are because we've mentioned every single one of them. Numbness, burning pain, cramping, sharp electrical pain. These basically, we're talking about nerves. Nerves are essentially electrical wires. So that's how it presents itself at times. Prickling and tingling, balance problems, which obviously is a really, really big deal. And then often it can keep us awake at night because of the suffering that we're encountering. These are not all the symptoms, but these are the most common. It's kind of like a cord. Have you ever had a lamp that had a cord that had a short in it? And the lamp goes off, so you play with the cord and it comes back on. And then it goes off and you play with the cord again and it comes back on. And you can keep playing with that cord for a little while, but eventually, no matter how much you keep playing with the cord, it becomes so damaged the lamp just won't even come on again. So this is how neuropathy often works. It's basically a shorten the cord, where sometimes it'll present itself with symptoms, and then it may even go away for a little while. And then it may come back with other symptoms, maybe the same symptoms, maybe more symptoms, or even different symptoms. But the instance or the frequency with which those symptoms will present will increase to the point where it's almost constant. And it's just like that cord, eventually it just breaks down to the point it just doesn't work anymore. What are the top causes of peripheral neuropathy? We mentioned diabetes as being the most common, but pre-diabetes is also a very significant contributor, along with what's called metabolic syndrome. And so that's a very profound contributor. Other things like poor circulation, what you'll learn is circulation is not only a great cause and contributor to neuropathy, but is also one of the key solutions to resolving neuropathy. Exposure to toxins, things like chemotherapy. About 50% of chemotherapy recipients will end up with neuropathy. Other exposure to toxins like often Vietnam veterans who have been exposed to toxins in war like Agent Orange, or high exposure to mercury. For example, for many years, a lot of fish had lots of mercury in the fish, or the amylogen fillings in our teeth that had a lot of mercury in them. Those toxins can actually create neuropathy. Anything going on in the spine because of the central nervous system and the large nerves coming out of the spine, if you've got impingements in those nerves, for example, herniated discs, spinal stenosis, degenerative disc disease, any of those types of things can put impingements on those nerves and create some neuropathy. Surgery, obviously surgery is there to help us and get us through things. But when they're in there doing surgery, sometimes they damage nerves. And so therefore, you can have neuropathy post-surgery. Things like autoimmune diseases, bacteria, viruses can cause neuropathy. Alcohol and tobacco abuse, thyroid conditions, liver diseases, etc. And look at the bottom there, even pharmaceutical medications can contribute or cause neuropathy. The one that I will mention that so many people are on is statins. Statins can actually contribute or cause neuropathy. If you have neuropathy when you go on a statin, it can actually be fairly significantly devastating to neuropathy. And unfortunately, many physicians do not know that. But you now know, and so therefore, with that knowledge, you can act accordingly. Now let's dig just a little bit deeper into the science. These are representations of nerves. For example, these nerves over here are what we call large nerves. They have names like muscle spindles, proprioceptors, etc. You don't have to memorize those names, but you see what we have here is this is the actual nerve right here. That's the nerve coming out, and then around it is an insulation, or called the myelin sheath. You probably already know that. And so there are different nerves that have different jobs or different functions. In this case, these large nerves are responsible for things like balance. So for example, if you're standing up straight, some of these nerves are sending signals to your brain to tell your brain about your position, and therefore your brain can tell your muscles to be stable. Or if you're walking, every time you strike the ground, some of these nerves will vibrate and let the brain know that vibration, so that your brain knows that you've struck the ground, and you can walk in a very stable, smooth, gait or pattern. Well, what might happen, or what might you experience if these types of nerves are damaged? Yeah, you're right. You may have balance problems, you may have stability problems, you may have falling, those types of things, which is a really big deal because we all know that falls are very serious, especially as we age. 1 of 3 adults actually fall every year. 20 to 30% of those can be moderate to severe in terms of their injury, and even 10% are fatal. In people over 65, the #1 cause of death is falling down. So really, really big deal in terms of falling and losing your balance. So as those nerves degenerate, the risk of falling goes up. Now let's look at these. We won't talk about all these fiber types here, these nerve types, but you look at these, what we call some alpha nerves over here, and some of these are responsible for things like sharp stabbing pain, some temperature sensations, those types of things. if those nerves were damaged, what might be some of the things you could experience? Yeah, you could not sense temperature changes when you should. For example, you could step on something very hot or put your foot in a hot bath, not realize how hot it is. Or you may step on something that's very sharp and not realize that you've stepped on something sharp. A quick example is a patient walking through her kitchen, didn't realize there was a piece of small broken glass on the floor, stepped on it because she couldn't feel the sensation because these nerves are damaged, because her feet are numb. Then she doesn't realize that that glass becomes lodged in the bottom of her foot. And after 10 days of that being lodged in her foot is when it's finally found and her foot's completely black, and luckily before they have to actually remove the entire foot. So just an example of how these nerves being damaged can create some very serious problems. And the reality is they can lead to amputation. Now, amputation is absolutely the worst case scenario. And so I'm intentionally painting that worst case scenario for you. But it's a very real scenario. And it's not everybody that has neuropathy is going to end up with an amputation. But it is a possibility that you need to be aware of for two reasons. One is in the case of that lady with that injury that she didn't even feel and didn't realize was there. The reality is that she may end up with an infection or some other more serious things that would create the need for an amputation, as well as the blood flow is compromised and therefore just even healing normal wounds is very compromised. Well, secondly, the thing you should know is that when nerves completely die, then the tissue around them completely dies as well. And therefore, the only option in that case is you have to remove that tissue. And so that's where amputation can become such a serious and a very real practicality for those people who do have neuropathy that continues to progress to very severe stages. Now, what are your choices? What can you choose to do? Well, one of the things you can do is nothing. You can choose to do nothing, which is a choice. Secondly, you can choose to go to your primary care doctor. But here's the thing. We mentioned the standard of care. And this is nothing against physicians. It's not physicians that create the problem. The entire system is kind of broken. But essentially what's going to happen is if you go to your doctor and you say, I'm having numbness, I'm having tingling, I'm having cramping, pain, those types of things, my hands or my feet, they're going to simply prescribe the medications that we've already talked about. And essentially all we're doing is masking the symptoms. The other thing they may do is they may refer you to a specialist. In this case, the specialist is a neurologist. You go to the neurologist, and what is the neurologist going to do? Well, they're probably going to start with some nerve testing. And that nerve testing is called an EMG. It's not the most pleasant experience, but they're probably going to do some nerve testing, EMG, and they're going to identify if you do or do not have neuropathy. And if you do, they're going to let you know that. Now, what they're going to do, though, is they're going to test the large nerves, and they will not be testing the smaller nerves. So if you have neuropathy of the large nerves, they'll let you know, as well as they'll assume that you have neuropathy of the small nerves, which is a really good assumption, great assumption. Problem is, because they don't test the small nerves, you could have neuropathy of the small nerves, but not the large, and it doesn't get identified. It's essentially a false negative. So you could have neuropathy in that case and not be diagnosed or even know that you do. No matter what they do find, essentially the standard of care is that they will simply give you more medication. Not really any different solution than what you would have got from your primary in most cases. And unfortunately, often what is told to people is there's really nothing that can be done for neuropathy. It's just something you have to live with. And unfortunately, just living with it really does not look very good at all. Now, doing the same thing over and over and expecting different results, what is that the definition of? That's right, it is the definition of insanity. And a very smart man is the one who defined that definition or created that definition. So if we're going to continue to approach neuropathy in exactly the same way and never expect different results, it truly is insane. And we don't have to. Because here's some really good news. The National Institute of Health says that peripheral nerves, as long as they are not dead, that they have the ability to regenerate. So as long as the underlying nerve cell is not dead, we can regenerate those peripheral nerves. So there's two sides to that story. One side is that if the nerve cell is dead, there truly is nothing that we can do. It is too late. It has progressed too far. But if the nerve cell isn't dead, we can regenerate those nerves. We can get them to function better than they do, decrease the symptoms that we're having, and most importantly, halt or stop the progression of it so it doesn't continue to progress to get worse. Now, when should you take action? Again, here's our nerve example here. Here's the little nerve coming out. We got the myelin sheath here. These red lines, what do you think those represent? Yeah, those are blood vessels. Blood vessels are supplying the nutrients and the oxygen that those nerves need. This is a very healthy nerve. What do you notice is the difference between this nerve and this second nerve? Correct, you see a lot less blood flow, as well as the nerve itself degenerating or breaking down. This is the point when we begin to experience numbness, tingling, pain, cramping, all those different things that we talked about. What do you notice about this very last nerve? Correct, there's no more blood flow. The nerve cell is essentially dead. It is completely deteriorated, and therefore it is too late. There really is nothing that can be done about this nerve. So when should you take action? Well, like most medical things, the sooner we take action, the better our odds at beating and resolving the issue. So it's much better to take action when we're up here, when we first start experiencing those symptoms, rather than waiting until it's too late. So what are some steps to feeling better? Let me give you 4 steps to start with here. One is we can rejuvenate the nerves by increasing the blood flow. We'll talk about how here in a minute. Secondly, we can stimulate the nerves so we can get them to regenerate. We can use some therapy, specifically some different types of therapy, manual therapies to activate them, activate the nerves. And then also we can decrease inflammation in our body in order to help those nerves regenerate. I'm actually going to talk about number 4 first, just briefly. Most of us don't realize, most of us know what inflammation is. If I were to sprain my wrist or my ankle, it would swell up. That swelling is the inflammation. It's acute inflammation. Well, most of us have chronic inflammation in our entire body, every single cell. How much inflammation that we have is dependent, and it's different for each one of us, but it's also dependent on a number of different things. But the number one thing that will increase or decrease the amount of inflammation we have is what we eat every single day. If we are focused on eating whole, natural foods as much as possible, unprocessed, we're going to have less inflammation. And if we're focused on eating highly processed, highly packaged, nicely colored boxed foods, then most likely we're going to have a lot more inflammation. Nerves are heavily impacted on inflammation. So one of the things we can do is approach our diet in much better ways in order to decrease inflammation. Well, let's talk about a couple of these other things. How do we increase blood flow? One of the ways we can increase blood flow is through what we call neurolight therapy. Neurolight therapy is simply using light therapy at LED lights at very specific frequencies. Those specific frequencies do a couple of things. They can actually increase blood flow in and around the nerves, as well as grow new blood vessels around those nerves, as well as stimulate the nerves so that they can be regenerated. So we can do it with light therapy. Well, did we invent this light therapy? Absolutely not. Well, who do you think did? NASA. NASA invented this therapy. They did a number of years ago, and what's happened is since they invented this therapy is it has been applied in many different ways. And one of the ways that it's been applied is in the treatment of neuropathy, and very, very successfully. You also remember that household cord that gets broken. Well, we've got to repair and regenerate that cord. One of the ways we do that is through electrical stimulation therapy. And so we actually use what's called a Hockamed unit. You can Google this and find information on it. It's made in Germany, and it's specific electrical stimulation that we can use to help regenerate nerves and stimulate them so that they can begin to function better than they do currently. So we can also use electrical therapy. We can also use vibration therapy. Vibration therapy has been shown to increase blood flow by up to 15 times, as well as stimulate nerves, as well as grow those new blood vessels around the nerves. And so in these different ways, the different modalities, we can actually regenerate nerves very successfully in many cases. Is there any research on this stuff? Yeah, there's over 2,000 references on using light therapy, electrical therapy, and vibration therapy in the body of literature out there on research that shows and validates the use of these for neuropathy. So one of the questions is, well, then why doesn't my doctor know about this? Well, there's a couple of reasons why. One of the reasons is again, that standard of care. Standard of care says this is the accepted practice for how we're going to treat certain conditions. And currently in the medical community, the medication route and simply doing the testing to identify neuropathy is the standard of care. So that's what's applied. Secondly, it takes on average about 23 years for the research to filter down into what happens in practice. It hasn't been quite that long since some of this types of treatments have been available. Thirdly, you think about, most physicians, the average office visit is only like 7 to 12 minutes. So in 7 to 12 minutes, your doctor has to sit with you, understand everything you're experiencing, determine what the diagnosis is going to be, and then determine what is going to be done about it. And in many cases, a very easy solution is simply to write a prescription for a medication. And so combined with that ease, as well along with just maybe a lack of knowledge and understanding about some of the more recent developments of what's available for treatment for neuropathy, that's why many doctors currently do not know about this. Also combined with the fact that most medical insurances will not pay for these treatments, at least not yet. That eventually I believe will change, just as 10 years ago, many insurances did not pay for other things like acupuncture or chiropractic or laser vision treatments, those kind of things. But now you're starting to see more of them cover those types of treatments because they see the value. Well, eventually, I believe the value will be seen in these treatments, and that'll be a part of the equation. But currently, that's part of the reason why doctors don't know about it or focus on it. But I want you to imagine for a minute, we're about to wrap up here, but imagine for a minute that you were able to actually sleep through the night, not suffering from some of the things you're experiencing. You had the confidence to feel steady, to enjoy the things that you want to be doing, to be as active as you want to be. And you enjoy being with your family and doing all the things that that might entail. And maybe you even feel younger. Can you imagine that? Just imagine that for a minute. And the question becomes, well, why do you even want to feel better? Well, I know people say there are no dumb questions, but that's a pretty dumb question. It's obvious. We want to feel better because our quality of life is very important to us. We want to have a high quality of life no matter what our age is. But secondly, what I find is that for most people, they have people that they love in their life. And when we don't feel good, we just are not the best for the people that we love. And so feeling better, having a high quality of life means that we both enjoy and can provide more enjoyment to the people we care about the most. So what do you do from here? What can you do? Well, one of the things that I would invite you to do is to consider coming and seeing us at the Neuropathy Center of New Mexico. Who should come and see us? Well, if you're experiencing any of the things that we've talked about, and maybe there's even some other things that you're experiencing that maybe fit into the nature of our talk today, then you would be a great candidate to come and see us. Well, if you wanted to come and see us, well, what would you do? What would happen? Well, first of all, we would have you reserve a spot so that you could come and see us. We would provide you a consultation and an evaluation in order to determine A, do you even have neuropathy? B, do you have a neuropathy that we believe we could actually help you with? And we'll be very straightforward with you. If we do not believe we can help you, we'll let you know that. And then finally, based on that, if we believe we can help you, then we would lay out a treatment plan that we believe would be in your best interest and truly get you results and get you back on the road to feeling much, much better. Now, in that evaluation, we would actually do a 16-point assessment where we're testing the different nerves and the nerve types to identify which nerves are functioning well, and if they're not, to what degree are they not. And so we do a very advanced assessment. We really take our time. Again, we're not going to do 7 to 12-minute office visit. Generally, our assessments will take anywhere from 60 to 90 minutes because we're going to be very thorough in understanding what it is you're experiencing, going through the assessment of both your peripheral nerves as well as the central nervous system to identify anything there that may be contributing. And we're going to do a really good job in identifying what's happening and understanding what you're experiencing. Now, we do require that if you're going to come and see us, that you do bring the person closest to you. We call that your VIP. Most of the time, it's a spouse. And so if you're not married, just go get married and then come and see us. Now, of course, you don't have to get married. But if you're not married, maybe it's a child, maybe it's a grandchild, maybe it's a close friend, partner, whoever that may be. But why do we do that? Well, number one, we want to understand everything we can about your situation so we have the best chance to give you the best treatment. So often we find that other person understands things that they can provide insight to, truly helping us understand. Or often what we find is that other person does not understand what you're experiencing, and therefore by having them there, they get a clear picture of what it is that you're going through, and they can get on board with moving forward and doing something about it. So it just gets everybody on the same page and creates a situation where everybody's got the same goal and producing results. Now, who should not come in? Well, if you're just not serious about getting better, it's probably not worth your time. And I find that often. I find people that despite the fact that they have the symptoms, despite the fact that we can even tell them that they may have neuropathy and how serious it may be, they just are in a mindset that it's not that bad, or they're just going to deal with it. They're not willing to confront the realities, and often maybe they even think they're the one person in the entire world that neuropathy is not going to get worse for. Well, if that's where your mindset is, it's probably not worth coming and see us. We are very passionate about helping people, and we want to help people that want to be helped and are really serious about it. So, but otherwise than that, I would invite you to come and see us. Now, normally we charge $249 for this evaluation. Because it is a very extensive evaluation and it is a very specialty type evaluation. So therefore, this is the normal pricing for what we charge in terms of doing that. However, because I don't have that $4.5 billion marketing budget that some of the pharmaceutical companies have, but I do have the ability to invite you to things like this, to seminars and events and educational classes like this, and I can educate you in groups of people, and so I can lower that cost quite a bit. So because you actually attended this seminar, I can actually offer you that evaluation for $89. There are a couple of things that you should know, and I want to be very straightforward and very clear on a couple of things. One is for that $89, what we would ask you to do is reserve a spot. We only have a limited number of those evaluations that we can give away or provide at those kind of prices. And so if you wanted to reserve one of those $89 evaluations, we would invite you to do that. And we'll give you the information below this video on how you can do that. When you do that, we'll actually then, by you reserving your spot, you would have to pay for that through the mechanism that I provide to you below. You have to pay for that $89. That holds your reservation, which then our office is going to call you and schedule an appointment that you would need to attend an appointment in the next 30 days. Now, the only last thing that I will make very, very clear about this is because we're holding that spot for you, and that means somebody else cannot take that spot that could and would want to get help, then that $89 is not refundable if you just decide to cancel or don't show up, because we don't want to keep other people out of the opportunity here. So again, below you'll see information on if you do want to reserve one of those confirmed evaluations for this $89 rate, then you can take care of that below. And then you can expect a call from our office to schedule your appointment. Now, let me mention just a couple of other things real quickly here. Sometimes people will ask, well, how much does the treatment cost? Well, first thing you should know is that I do not know, because it's kind of like calling up the mechanic when your check engine light comes on and saying, I got a check engine light on, how much is it going to cost? He doesn't have any clue until he gets the car in there and checks it out and finds out what's going on. It's the same case with this. Until we truly understand what's going on with you, what's contributing it, how long has it been, how severe is it, we don't really know what the treatment plan is going to look like for you. So I can't give you an answer. I can give you a range. It can be anywhere from just a few $100s to several $1,000s. It just depends on a lot of conditions. But then the question becomes, well, what is the value that you're going to put on your mobility and your independence as you age? You know, again, treating our cars better than ourselves, or we're willing to spend $4 or $5 on a cup of coffee, uh, or going out to eat multiple times a week for, quite a bit of money. Um, what about ourselves? What about our quality of life? What about, again, our mobility and our independence? Well, if it's worth even understanding what your situation is for $89, we would invite you to come and find out what that is. And then and then you're an informed consumer, and you can take the information that we provide and the treatments that we can offer, and then you can decide for yourself. And so if that's worth $89, we would invite you to come and see us, and let's do that. Final thing that I'll mention is that most insurances, again, will not cover this. You have to know that. Our clinic, our facility itself, does not take insurance to begin with, but we can provide you documentation about your treatments and your examinations, where if you wanted to get and try to get reimbursed from your insurance company, we would be able to provide that to you, but that would be something that you would need to do. So again, I just want to be really clear, really upfront about a couple of those things, even before you make your decision of whether you're going to come and see us. Now, in conclusion, I thank you so much for attending this seminar. I hope you've learned something. I hope you have found it valuable, but I can't emphasize enough that neuropathy is progressive. It does get worse. The best time to take care of it is sooner than later. And so I invite you to come and see us if you believe that you would like to find out the details of what your situation is and what could be done and what we can offer in terms of help. We've had great success in helping people decrease their suffering, stop the progression of the disease and the symptoms and the problems that they're having, and be able to provide high quality of life moving forward. Now, the last thing is below here, you'll also see a few videos of a few patients of ours. I encourage you to watch those, see what their experience is. Thank you very much. Have a great day, and I hope that we hear from you. We would love to see you at our center. Take care, and we'll see you soon.